Much, Henrik. It's nice introduction and also for inviting me, also being organizers in general. I'm very glad to be here, and it's true the hotel is spectacular, but again, I didn't know it before I came here, so that was certainly not the reason for me to come. Yes, I placed a focus on plasticity of social cognition in my talk, so today it's going to be a bit of bits and pieces from the group from the past year, mainly focusing on intervention studies that we did, and mainly in individuals with autism and children as well as adults with autism. Yeah, so I would like to on a first note, make the claim that all mental disorders are dysfunctions in social interaction, and we have seen this in Marcel's work in his great meta-analysis that he showed. This is certainly true for some disorders such as autism, where it's a defining characteristic, but also for many other disorders where it's involved in the etiology or in the maintenance of the disorder, some of which we see here and some of which we have heard a lot already about today, for instance, borderline personality disorder. I would also like to suggest that social dysfunctions are very important risk factors for mental disorders. So I think we can see that there's really a reciprocal interaction between social cognition, and mental health. That's very important. And social settings can be both strong stressors and resources for social cognition. Also, this we have seen in some of the talks that we have seen today. So I don't tell you anything new here. So we have actually a transdiagnostic clinic. I'm head of an outpatient clinic in Berlin. That's the outpatient clinic for social interaction, where we treat people that approach us because they have social problems mainly. Many of them think they have autism. Not all of them get out from our clinic having the diagnosis. Other diagnoses that we diagnose are, for instance, social phobia or borderline personality disorder. So we try and take a somewhat more, transdiagnostic stance. Yes, okay, good. I guess I don't need to tell you too much about autism. We have seen already a few presentations on autism. That's why I'm really glossing over this, just maybe saying so much as to say that really the social impairments are the key and defining characteristics of these conditions. I brought you a little video of Carl, a engineer, a mechanical engineer, who talks a little bit about his way of perceiving the world.
Such a spectrum.
So he reports about his way of perceiving social signals, and I think he makes pretty clear how many of the subtle emotions of everyday life really are beyond what he can grasp. And this is something we ask in the context of making an autism diagnosis. How do you perceive social world? How do you perceive emotions? At the same time, we are also, when making a diagnosis, look at something we call shared affect. And with that also, how do people with autism express emotions, and not only how they actually recognize them. This is something we need to do when we use the gold standard of autism diagnosis that probably most of you know, the ADOS and the ADI. So in the ADI, we obviously ask the parents, but in the ADOS, we create situations, social situations with the patients, which allow us to really observe social behavior at work. And I mean, we, but many others have done studies where we look at, for instance, mimicry and subtle imitation of, for instance, laughter and smile. Yes, something we see here, the shared smile in people with autism and healthy controls. We have used machine learning approaches and artificial intelligence to do so. So we do this based on video data now, whereas a few years ago, we still used EMG. we now do this also video-based. And we do see that the implicit but also explicit imitation of facial expressions of others in more naturalistic context is actually something that is reduced in autism. It's less strong and it's also slower than in healthy controls. And that's obviously kind of difficult to see as a clinician, and it takes a great deal of expertise to learn actually to diagnose autism, specifically to see if social signal emission is something that's autism typical, or is it more related, for instance, to depression? Is it more related to social anxiety? That's really very tricky. Those of you being involved in autism diagnosis probably know that. So we have developed, this is a new technical tool we have developed a few years ago, and I just see that my screen is always cut a little bit, but I hope that everything will be on it. So here we asked an actress in a film studio to involve a patient in a simulated interaction, which is 6 minutes long. And this actress talks about food issues. She talks to the patient how she lays a table. That's a neutral excerpt. Then she says, talks about food that she absolutely likes, and she expresses a lot of positive emotion while doing that. And after that, she talks about food that she doesn't like at all, and then she expresses disgust in her face. And between these, she always asks the person on the other side, so what about you? What's your favorite food? Or what's your least liked food? Or how do you lay a table? So it's really a pseudo interaction. We do tell the patients, obviously, this is a simulated interaction. And I mean, this is in German, but I still brought you an excerpt so that you see how that actually looks like. So I have pizza with regular. So she talks about the cheese and everything on it. Now it's your turn. What's your favorite food? She asks, and then she engages a bit in empathic listening behavior. So she nods here and there. And so the patients before that actually know that they are to prepare 2 or 3 sentences for these things to answer for the questions. That sounds really nice. So what we did with these data, these video and audio data, that's really just 6 minutes long. And here you see the situation, how it looks, very similar to our typical video communication interactions nowadays. So we do record the face, and also we look at eye gaze. So we use open face that can automatically track action units in the face, as well as has an eye tracking integrated. And then we use an R library, the Librosa library, that can analyze prosodic features of the voice. And we did this in 37 adults with autism and 44 controls. And then using machine learning, we looked, based on these signals, how well these data can predict if somebody has an autism diagnosis or not. And these are receiver operating characteristic curves, ROC curves. And the more a test or a piece of data is here close to the X and Y axis above, the better it does in discriminating between the groups. And you see when we take all of these prosodic and facial feature data together, we have almost an accuracy of 80%, 78% to predict who of these adults has autism and doesn't. And the voice really does best. And we have actually recently replicated this study in even more adults with autism and a totally different sample, where we yet again found an accuracy of actually here even more than 80% in predicting group membership between neurotypicals and people with autism. So this is Hannah Grimala, who did this as a PhD work in my group. She's now actually professor, junior professor at the University Bielefeld. And so we actually, I mean, you have to know that obviously we are not using this to make a diagnosis alone. People come into our clinic 5 times to get an autism diagnostic. But we know a lot of people that have their practices out there that are not specialized in autism. And again, this is a puzzle piece of the autism diagnosis, which is specifically difficult to make, where you need a long time to actually get expertise and And so we are thinking that this might be a good tool for clinicians out there to use, to help them a little bit in their estimate of nonverbal social signals in autistic adults. We actually used this also in 10, we showed 10 therapists in my clinic that are engaged in autism therapy and diagnostics, these excerpts, the 6-minute film of the person really telling about their dinner preferences. And we asked them, what do you think, just based on these 6 minutes, is this a person of autism or not? And interestingly enough, the therapist had an accuracy rate of 0.7. So the machines really here outperformed the therapist. And interestingly enough, also, there was a super high correlation of 0.85 between length of dealing with autism diagnosis and accuracy in predicting who's what. So the person in the group engaged most years, almost 20 years with autism diagnosis, got all 10 people right that she actually looked at only based on these video excerpts. Yeah, so this is just a little piece of a recent study that we did on diagnostics, and now I will come to therapy options of adults with autism. And although autism is so prevalent nowadays, and although autism seems to be in the media all around much more than other disorders or diagnoses, it's actually very interesting that there's almost no psychotherapeutic or in general therapeutic approaches out there for adults. I mean, there's no pharmacotherapy that's suggested. And there's maybe, about 50 studies out there in general looking at interventions, and only really 9 rigorously done randomized controlled trials that all target more or less comorbidities and not really social functioning. So that's the situation out there. So we're in desperate need really of services for these adults with autism. Many people with autism seek psychotherapy. We know that about 70% of autistic adults would like to do therapy, but many of them say that they actually can't find therapy, that they are rejected by therapists because the therapists say, I don't know enough about this clinical picture. And this is something you see here. We conducted a study in autistic adults and compared their answers to people with major depression. And when they said they didn't get therapy, the most commonly used or statement was because the psychotherapist had no experience with my diagnosis. And you say that about 40% of people with autism say that, while there's no person with MDD that actually said that. We did a companion study looking at psychotherapists in Germany. So we recruited all in all over 500 psychotherapists in Germany and asked them, what's your level of expertise in assessing autism, in adults, and what's your level of expertise in treating adults with autism? And as you can see, we compared to other diagnoses, it's a bit small here, second ADHD, then schizophrenia, eating disorders, OCD, and so forth, and very much on the right, depression. And you see that autism is really the diagnosis out of all that scores least. So adult psychotherapists say, I don't think I'm I'm not very competent in actually diagnosing or treating autism. We also asked them, how much did you learn about this diagnosis, of treatment of this diagnosis in your psychotherapist training or at university? And lo and behold, they say that this is really, they got least information about this. This is something we're currently trying to change in Germany. So based in part on these data that we have published here, we're trying to change the curriculum in universities and also psychotherapies curricula. Now, interesting enough, that study was done mainly by people with autism. So, an important question like this, it needs autistic people to come up with the idea to actually do that study. This is a study that was done by the Autism Research Collaboration. It's actually a user-led project. It's a project where people with lived experience, so with autism themselves, actually decide what studies are worth being asked or what questions are worth being asked in science. And they contribute to this science all along the way, from conceptualizing the study design to collecting data, to analyzing, interpreting data, to its dissemination. And I wanted to at least show you a little bit about this group. So this group was founded in 2007 by myself. Although I have to say I'm much more in the background now. So it's really a project that's mainly run by people with autism themselves. So we have 40 members, the majority of which has autism, about 30, I would say. And we mainly do surveys, obviously, not genetic research or imaging research, but we do research that everybody can kind of engage in. And when we started in 2007, we still did paper and pencil surveys on Alexanderplatz here in the center of Berlin, or conferences. For instance, we once did a study to see what are the prejudices and what's the knowledge about autism in general practitioners. So we went to a conference of general medicine. And nowadays we mainly do online surveys. So in one of these surveys, actually, which was published by Silke, that was our first paper being published in JAD, so in a real journal. Before that, we only kind of did posters a bit and leaflets. We asked people with autism, what are you seeking when you seek psychotherapy? What do you seek help for? What are really the desired treatment targets? And we compared that to people with a major depression. And you see that very similarly, so in blue is autism, that depression and low spirits is of utmost importance also to people with autism, but that there's a few things where the blue lines are longer, such as interaction and communication problems, coping with everyday life, problems with inclusion, problems with social exclusion and mobbing, for instance. So, and we tried to come up with treatment regimens that kind of focus on this, on the specific needs of that group. So here you see actually a leaflet with all the studies we do in that group, in this participatory group. We develop leaflets that are somewhat funny. There's always a funny comic here that shows some kind of misunderstanding. Here, for instance, in German, we have the saying, "Wo drückt der Schuh?" So where's the shoe too tight? That means, how are you doing, basically? What are you suffering from? It's, and then the person with autism answers about their shoes sometimes. So it's shown that they can react very well often to pragmatic aspects of language. So it's always a bit funny. And then we send these flyers here, for instance, that's a study about the knowledge and prejudices of psychotherapists towards autism. We sent this to large psychotherapist clinics, for instance, in Germany, and disseminate these to make sure that the results are not only stay in the ivory tower, but that they help actually change reality for autistic people out there. This is also something we are doing currently at the German Center of Mental Health. We have rolled out this idea of participatory research much more so in Germany now to all different kinds of diagnoses. And I'm heading the infrastructure of PPI, of patient and public involvement. So this has lately in the past years been a large focus of my work, actually trying to see how we can, by including people with lived experience in our research, actually make it better, make it more relevant, and make it also more valid. Okay, stop. The video is already running. This is an intervention that we developed also already many years ago, more than 10 years ago, but it's now in the second phase being evaluated. It's the social cognition training tool, where we're teaching people with autism to understand complex emotions. So we have 40 emotions that are trained within a serious game. So we paired up with 80 actors, went into the studio and filmed facial expressions, got voice excerpts for these 40 different emotions, and also had little soap operas similar to The Mask. Those of you who know The Mask, where we had, I think we produced 200 or 300 of these little excerpts to help people understand emotions. We have a large emotion library where all of these 40 emotions are displayed, where you can see what kind of bodily reactions they arise, how close they are to each other, and so forth. Yeah, and there was also a participatory design process where we had a lot of rounds. It was an iterative development, like often done in engineering sciences, where you develop something, then you come together with stakeholder groups, they give you feedback, and then you develop further, so that after a certain amount of time, it kind of fits nicely the needs of people. So this is a small excerpt of one of these interactions, also in German. So in the beginning, we give a little bit of information about the situation. So she finds out her ex-boyfriend has won in the lottery 2 million euros. He was always very jealous. Oh, you have liked him all the way, right? Back in the day. So he's jealous of him. And then look. I stop this here because if you don't understand it, it doesn't make so much sense. But then it's basically you do see different excerpts as to how the situation might finish, and only one of these alternatives makes sense based on the emotion and social cognition context. So this is just one idea. I mean, we have all in all 8 different modules in this training. This is just one module out of them. So it's in a very playful manner. Patients can engage in this training. So in the very first version, this is actually the first version that was already designed 2008. This is a new version that was developed 4 years ago or so by a different company, and this is now has been integrated into a large multi-center trial, which is almost ready. But I show you this a little later. So this is the pilot study where the program still looked a little differently, and what we did here. We screened, or we involved 57 individuals with autism in that study that were then either randomly assigned to this treatment that I just showed you, or to a control training, also an online training, where games for visual attention, a little bit memory, planning, and so forth. So everything but non-social tasks. And the training was just as long as the social training. And then a portion of these patients also went into the MRI scan. So what we found was first at the level of emotion recognition in faces, we did see that the people with autism that trained with the SCOT, with the social training, increased their abilities to recognize faces. And obviously, these were not the same faces that were also trained with in the training, but other ones. Compared to the control group, and also in tasks of social cognition that are more ecologically valid and distant from the training, we also saw an increase in the score in these patients as opposed to the control group where we did not see such change. This is Gabriela Rosenblau, who did this as her PhD work in the book. So what did we see on the brain level? We designed a theory of mind task or a mind mentalizing task that we published separately and then used in that study here, where we found that people that went through the social training, people with autism, actually showed a decreased activation of regions of the social brain here, for instance, inferior frontal areas and posterior parietal areas. And that activation scaled with the competence increase that we see saw in the emotion recognition task. So that shows a little bit of the relevance of this activation, the brain activation change. And we also did structural MRI, so we looked at cortical thickness in these individuals and also found a group by time interaction. So in other words, the SCOT group increased cortical thickness in a confluent area, actually, where we also found changes in activation here in the inferior frontal cortex as a result of the training compared to the control group. So we did find some kind of evidence on the behavioral as well as on the neuronal level that there's plasticity in the social brain. Okay, I just told you, although I'm not going to show you any of this now, that we have just done and completed actually the largest clinical trial to date in adult autism. So we involved 360 patients with autism in 6 centers in Germany that went either through this SCOT training or through a group-based psychotherapy. And we have also, by a separate grant, done an ancillary study, an imaging genetics study, where 120 of these 360 patients actually also got fMRI, structural and functional MRI. And we are currently last week we had last patient in, so we actually, after 4 years, we have now collected 360 patients, but unfortunately the unblinding hasn't been done yet, so we need to wait until we have the follow-up period in 3 months, and only then will we see how the data looks like. Okay, next step, social cognition intervention in children. Very similar rationale as in the adults. So we have developed a tablet-based intervention here also already 10 years ago. It's still not on the market, so that shows you the difficulty of sometimes developing these tools, running randomized controlled trials that show it's effective. But then because I'm not trained as an entrepreneur, and I don't want to even earn any money with this, just the maintenance of these tools, costs money, and basically the dissemination of these tools costs money, which we usually don't get by applying for grants. So it's really a tricky endeavor. So here it's a tutor-based program. Children of 5 to 10 years of age plays it with their parents mostly, but also with teachers. So they sit together and run through these modules. Although you can also do it on your own. My children played, when they were small, they played this on their own and they loved it. It contains 4 modules that train the recognition of own emotions. So the children are shown little videos that are either of differently valenced content, and then the children ask, how do you feel at the moment? They have a little puppet, a little self-assessment mannequin that I'm showing you soon, where they can indicate how aroused and how positive, negative they feel. Then we have something, Gefühle in der Welt, so emotions in the world. How are some situations in the world associated with what kind of emotions? So what do most people feel in certain situations? Then also Gefühle anderer, so emotions in others, but also then empathy and pro-social behavior. So we show videos of people in certain emotional situations and then ask what do you feel in response to that person feeling that emotion? So we go really a step further than in Scott. We try and catch the whole empathy chain, I call it, a bit. And yes, so this is Simone Kirst, who did this also as her PhD work in my group. This is also a short excerpt of one of the emotion recognition modules. So what is she feeling? This is super, yeah. And they can gain little icons, and then they fill the manege with little blinking stuff, and so the kids really like that. This is the emotion library. So here we are not training with 40 emotions, we're just training with the 6 basic emotions. So you can go in this library and check. Oops. So there's a card, and you see different papers. These people are anxious. Most people feel anxious here in these situations. This is this mannequin that I told you about, that the children can direct themselves. It had a little mistake here, so it usually doesn't flicker so fast. Yeah, so this is just for you to get a little glimpse of this intervention. And here's how these data look like. We had pre-registered that study with the primary outcomes being empathy and emotion recognition, because we thought that's what we are training. So we hoped to see the results there. And its secondary outcomes, we had also emotional regulation and autism symptomatology. This was actually done in 80 children with autism, also a multi-center trial that we had in Austria and in Germany, actually. And what we found, we had 3 time points. This is pre-training, T1. This is post-training, directly after 8 weeks. And this is after yet another 8 weeks. So what you see is that empathy and emotion recognition increased in the people trained, or in the children training with Circus Empathico, because that's the blue here, compared to the other group that actually trained, I should say, with a language tool. So they also engaged in a tablet intervention with their parents, but they learned English with a kind of a fun app at the same time. So that was our active control group. But you also see that after 2 months further, these effects actually couldn't be maintained. So they slipped back to base, or not to baseline, but basically to no difference between them and the control group. Interestingly, in these other outcomes, they were much more stable, so which we hadn't thought. We thought really these are the mediators for this kind of, but what you see here, I mean, autism symptomatology was really got better in or less symptoms. That's why it goes down in the autism group that trained with Circus Empathico compared to the language tool. And these effects were maintained. And interestingly, these effects were not only shown by parent rating, but also by more independent teacher ratings. So we asked also the teachers of these children to give us an estimate of the social functioning and the autism symptoms of these kids. And also in emotion regulation, these results were actually maintained over time. So that shows up, but probably I don't think that there's nothing in here. It just means that some of these maybe more hardwired constructs that we train here maybe need a little more time to produce lasting effects. We actually also did this study or did this training in preschoolers without autism. To see, it's kind of a preventive tool to prevent mental disorders. So we did a 6-week training here with children, and we accompanied these actually with EEG. That's Sandra Naumann did that study as her PhD work in my group. And so we actually found after the training that the people or that the kids trained with Circus Empathico here as compared to the Squirrel and Bird language app, they also increased all kind of social emotional functioning, empathy, emotional regulation, emotional recognition. So basically, all 4 were significantly increased. Here we have a composite score to make it a bit easier, but also on a separate level, they were all increased in these children. And on the brain level, we did see an increase in the P3 in response to happy over angry faces. And the kids that trained with Circus Empathico, which we took as we interpreted as a somewhat faster maturation, because usually in that age, these kids were actually all 5 years old on average, so a bit younger than the autistic kids. Because in that age, positive valence is somewhat increases steeper in maturation than negative valence. So I don't know, that's speculative, but that's our interpretation. So we do see that it's also malleable, that it is plastic, the social brain, not also in autism, where there's maybe more to gain, because some people say, okay, kids with autism have a lot to still learn, so maybe it's effective there, but not in controlled children or neurotypical children. We find that it's plastic in both children with autism and without autism. We have now taken this intervention, actually, the Circus Empathico, and brought it to a robotic platform. This is a study we have just completed, or last year, actually, beginning of the year completed, where we were the only psychology partner among many partners from the industry that develop AI tools for measuring social signals, emotional signals. So this is the robot, the humanoid robot Pepper. He has in his eyes cameras that track facial expressions and eye gaze. He has microphones in his mouth, so he actually records the speech of the children, and also actually the cameras track pulse by video data. So that's now a thing that's actually pretty new and pretty reliable, that pulse can be measured via video data in a subtle change of redness of skin that is related to pulse. And the idea was to develop an intervention that's adaptive to the child. We didn't get that far, I have to say, so the development was much, much slower than we thought in the first place. But what we were able to do, so we developed one emotional recognition, one emotional regulation module. And given that emotional regulation is really something that parents reported as much more important for everyday life than emotional recognition, that's what hurts family life, is disturbed emotional regulation, outbursts of anger or tears all the time at home, rather than reading emotional faces. So we focused here on developing an emotional regulation paradigm. We developed a game that was pretty frustrating, but also fun to play, where you are a little avatar that has to take care not to get hit by these balls that run around here. And so we use an adaptive approach where the children play in such a manner that they are always frustrated in 60 or 70% of the time. So, and then we stopped in the games to teach them emotional regulation strategies. So the robot teaches them actually breathing exercises to calm down when the arousal has risen too hard. We did this here, but first in 44 neurotypical children and just 10 children in autism. Again, Simone did that work. She did this now as she's still in my group as a postdoc. This is a little video also in German, but you get an idea how it looks. So I'm glad to get to know you. How are you? Did you ever meet a robot? I still have some mistakes, so don't be too disappointed if some things go wrong. This is the game. So to induce anger, it's the game. And that's not one of the breathing exercises. So we use the embodiment of the robot to show the breathing, the extension of the chest. So the kids really like the robot, and obviously we're not trying to replace therapists, but very often the robots are somewhat of an icebreaker. They're much more predictable in terms of emission of social signals, and many kids with autism are very attracted by technology. So it's a great additional means to therapy. And what we see that, first of all, we did acceptance and usability studies where we see that actually that there's great acceptance among the parents as well as the children of the robot. But then we also looked at arousal and valence data. Here, this is not the automated recorded data yet. This is just a subjective data that's recorded, but you can see that the children reduce their level of arousal and slightly also the level of valence towards the better after they engage with the robot in these breathing exercises. Yeah, so this is something just to show you, I mean, this is a rather modern approach, obviously, and laborious, but it's somewhat more embodied than what we usually do with technology, where we work only in a two-dimensional space. We here in this study for the first time went into a more interactive three-dimensional space. Okay, and now a fun study that's already a few years old, actually, but I thought I wanted to bring this to you because it has a very different approach, namely a bodily approach to training social cognition, which I think is super important and is all too often neglected. And I showed you so much technology, which seems maybe I love only technology. That's certainly not the case. So going back to the very initial idea of imitation, I've shown you imitation in faces, but there's also a whole body imitation. And you know, autism has always been coined an imitation disorder too. And I brought you one quote of an autistic woman, how she talks about her way of synchronizing and imitating others. From the beginning, I was lacking the natural drive to reproduce the actions, gestures, or facial expressions of others. As a baby, I did not reciprocate smiles or grimaces, and later I noticed that in situations of, for example, applauding, I abstained from joining in those rituals. As a consequence, I did not learn as a child to mind and react to others' emotions. Such a child remains socially underdeveloped. So here, Nicole Schuster makes this association between movements and social cognition, or and social interaction. And this basically relationship is something we looked at in this intervention study. So it was a study that was meant to develop an intervention at the same time to be somewhat mechanistic in nature, to use autism as a model of deficit in social cognition to look if some of these relationships are really true. So in that study, we paired up with a dancer and a choreographer. Actually, she was my neighbor. That's how we started that study. And also with a dance therapist. We developed an intervention for autistic adults that has 10 sessions that really have as a core imitation and synchronization exercises. So social whole body imitation and synchronization. It has a bit of movement expression at the beginning and awareness, body awareness as kind of framing elements, but the core is really imitation and synchronization. And I brought you a little excerpt also of how this intervention looks like. So it's a small group leading and following. One person would lead, the others follow. And circle dances. And then in choreography. What about synchronizing different? So loud, sorry. So what we did is we randomly assigned 55 adults with autism, either in this intervention or into an active control group where also people of groups of 8 people with autism would meet once a week over 10 weeks to do kind of a circuit training. So they would not interact, they would also engage in physical activity, but they did different stations of, for instance, learning how to juggle or being on a treadmill or doing yoga postures. They had the same instructors that were also in place here in this intervention. And yeah, so what we did, what we looked at is both. First, on a very close generalization level, we obviously looked at imitation and synchronization. And we have seen the automatic imitation task of Marcel Brass already a few times today. So we used that actually to not look at imitation inhibition, but to look at automatic imitation. And we found that over the intervention, here you see in dark green the imitation and synchronization group, they increased their tendency to imitate actually over these 10 weeks, while the control group did not change their scores over this period of time. And we also did, in collaboration with the Max Planck Institute of Brain Sciences in Leipzig, a study on, we included a task on synchronization. Here the subject actually with a tapping board engages in the drumming with different drummers that are differently adaptive or human-like actually. And what is the dependent measure here is basically the asynchrony of the reaction of the subject. So you basically have to read it in a reverse manner here. So what you see, because asynchrony is the dependent measure and not synchrony, and you see that the asynchrony decreases or the synchrony increases in the group with the imitation and synchronization task, which was not the case for the control group that just did the circuit training. So at the close generalization level, we saw that what we sought to train, namely imitation and synchronization, somewhat went okay, but that was obviously not why we did that study. We wanted to look what effect does that have on social cognition. So we looked at cognitive and emotional empathy and wanted to see if there's really an association between the two. And so what we saw is that using the MET, we did see an increase in empathy actually in inferring mental states or mentalization in the group that trained the imitation and synchronization, but not in the control group that did the circle training. So for us, one thing is nice, it actually ended up that study in the guidelines for autistic adults a year ago. It's one of the few interventions that is suggested at all for individuals with autism, so a synchronization and imitation-based movement therapy. But at the same time, it has a mechanistic, value for us to see really that bodily imitation and bodily processes here are related to higher social cognitive functions. Yes, and with this, I come to an end of my presentation. So I hope you saw that social cognition plays a role certainly in autism, well, that we think that using a transdiagnostic approach also is interesting, and that looking at mechanistics is very good in doing these kind of studies, so looking more targeted. Obviously, there are many effective treatments, or there are many roads to Rome, how I call it here, and you can't really say that one intervention does it and the others not. As variable as targeting bodily factors and using digital or analog means can all lead to good interventions that basically bring about plasticity in the social brain. And one thing that is also increasingly important to me is that patient and public involvement can increase the validity and quality, and certainly also legitimacy of research. And with that, I thank you very much for your attention and the people of my group who have helped with these studies.